My presentation will be about this regional study we conducted last year in 6 countries that you see mentioned on the screen now. I would go through some of the regional results, and then we will go more into details on, as Victoria was saying, on the experience of Belarus, because some of these 6 countries also conducted prepared national reports with the specificities of the country. So in the outline, I will give the introduction to the study, explaining also what kind of methodology we used for the study, the key findings, and then recommendations. And I will go quite briefly through the recommendations at the end, because tomorrow we have a full session at the end of the conference to also see recommendation for Belarus based on the results of the study. So, why a study on the parenting of adolescents? Just a second. Why? So, first of all, because through literature review, we conducted a literature review of regional literature about the parenting of adolescents, and we found that there was no comprehensive study. There was some information maybe related to some specific topics, and sometimes often what happens also is that when you read the literature about parenting, it doesn't really differentiate a lot between adolescents, and it doesn't focus specifically on adolescents. So it was difficult for us to find existing information on specifically on the parenting of adolescents. On the other hand, we also know that from our experience in UNICEF, some of the countries where we work in had some experiences of supporting programs related to the parenting of adolescents, but there was no comprehensive mapping. We had some scattered information here and there. A lot of it was not really well documented, so we also wanted to see what's the situation, what's the state of the art in the region. There's also, talking about literature and international literature, there's a lot of information coming from high-income countries, and we have very little evidence on what works in middle-income countries, which constitute most of the countries in our region. Parenting is a cross-cutting issue. We see in our work at UNICEF at the regional level, but also in the countries, of course, that the role of parents come out across the different programs. They have an important role in relation to development outcomes related to health, education. So it was a key topic that we needed to explore more. Specifically related to the second decade of life, because UNICEF has more experience and rich experience focusing on ECD, less on parenting of adolescents. And then maybe because one of the flagship results that we're moving with country offices at the regional level is related to the participation of adolescents. And we think that participation starts within the family. It's involving children in decisions within the family. And so we needed to explore more what's the situation of the region is. We used a life course approach in the study, meaning that we analyzed not only how parenting changes based on the age of the child, how caregivers parent differently if the child is a young child, if it is a young adolescent or an older adolescent. So we tried to look at variation on how parents behave based on the age of the child. But then we also looked how parents themselves were brought up. So we tried to identify across the life cycle how the intergenerational relationships change based on what the parents experienced, and based on compared to how they are teaching their children. We used an ecological framework, trying to understand what are the macro factors that have been and are influencing parenting in our region, what are the interpersonal factors, and what are the individual factors that influence parenting styles and attitudes. The study had 4 key questions. The first one was, how is parenting understood, perceived, and practiced by parents and caregivers of adolescents themselves? So we asked parents and adolescents. You see, we have at the top 727 respondents across the 6 countries, and half of them were actually adolescents themselves. So we asked them, how do you understand adolescents? How do you understand parenting of adolescents? What is the ideal parent? And what should be the role of the ideal parent? And we looking specifically at what is the role of mothers, how they understand the role of mother, of fathers, to try to understand better the concept of parenting. Then we looked, as I said, at the factors that are influences at the macro, interpersonal, and individual level. Where do adolescents seek support, and also their parents? Where do they look for support? Formal and informal support related to parenting. And then the last question to guide our work in the future is, how can parenting programs be improved to meet the needs of parents, and particularly looking at parents and from the most vulnerable families. The study looked at the primary data collection. As I said, 727 people were interviewed, half of them adolescents. We looked at, we involved the most marginalized families and their children, Roma adolescents, parents of adolescents with disability, parents of adolescents, adolescents living in institutional care. So we really try to explore a variety of opinion based also on specific vulnerabilities. And then there was also a secondary analysis of existing data on the existing literature, and a review of international, regional, and national laws in the 6 countries related to parenting. So when we look at the macro factors, this is a quote that came from a government service provider in Georgia, that gives a sense of some of the changes that happened in the region. So you see, he said everything has changed, it's just different. In Europe, in the USA, the changes happen gradually, but basically here in the region, they happened in a much faster way. And this has had very big implications for how parenting changed in the region. The context is that the transition from a planned economy to globalized global market has raised many opportunities, but as Larissa also mentioned somehow in her presentation, has increased vulnerabilities for families and their children. This economic instability and the rising costs related to life has left a lot of families with really big struggles, because they need to provide their kids with services that were free in the past, that are not free anymore. So there's a lot, they have much more pressure to work more, to take multiple jobs, and this leaves families with less time to spend with their children. And this is a big, it was mentioned also before by Larissa, basically. These parents have little time for their children. They need to provide for their children. There's a lot of pressure to take several jobs to be able to survive, and this has big implications on how much time they spend, particularly with older children or with adolescents. Another issue that was mentioned by Larissa, migration. In some of the countries, in the 6 countries, 25% of parents have migrated, they live in other countries. This has big implications for the relationship with their children, but also the way they communicate with their children, but also to the fact that many of these children are left behind with either the grandparents, which is a bigger intergenerational gap, or some of them are even left basically alone. So this, of course, has a big implication on how parenting has changed. And then the introduction of international standards has also left parents, and the adaptation of these international standards to national laws and legislation has left many parents with a lot of doubts about what's their role, what's their responsibility, something that was acceptable before in terms of beating your child or using violence for your child is not acceptable anymore. And this has left parents with a lot of doubts on how to bring up their children. And of course, the digital age, which is also one of the topics, it says that the internet has opened society to a lot of information, which is also changing relationship between parents and children, because information sometimes is also power. And this is shifting the power relationship within parents and their children, because children have much more information. They know when their parents talk that sometimes it's not correct what the parents are saying. They know how to respond, and this is creating also a lot of tension. And sometimes actually they are the one who are digitally more experienced and they know more than their parents. So this is creating an imbalance in relationships compared to the past. In relation to laws and policies, while the states are obliged to support parents to fulfill their duties of care by children by international standards, states are obliged to support parents, few national legislation actually describe this part. And it's more about parents are responsible for raising good kids, but there's very rarely information on how the state will support those parents. So there's a lot of responsibility on the parents themselves, sometimes also sometimes a punitive approach toward parents. If you don't do your job, then you will be punished, but there's very little on how the state is responsible for supporting those. Then few laws recognize adolescence as a specific stage of life that requires additional support, that require a different kind of support compared to smaller children, of course. So this is also one point that we see is lacking in the national legislations. And then mostly national legislation, they look specifically at very specifically at biological parents. But we saw that the reality of these countries is quite different, and sometimes you need to tackle the broader family environment, such as grandparents, because actually this is where a lot of the kids spend time with. So how is, going back to the first question of the study, how is parenting understood, perceived and practiced? So, despite the fact that adolescents seek more independence, they like to have more freedom, parents continue to stay the most important figures in the life of adolescents. The adolescents are saying, our friends are important, but they come and go. Our parents will stay. So they still look at their parents as the primary figure in their life. They trust more than parents than peers, mostly. We saw some variation where, for example, for children who live in institutional care or are in conflict with the law, they rely much more on their peers. Adolescents want to spend time with their parents. They interpret time as a signal of love of their parents, and so this creates again, and it links to what I was saying before, the lack of time because of very practical situations that I was describing before, taking multiple jobs. Sometimes it's interpreted by the adolescent as lack of interest in their life. And this is one of the main issues that they raise. Then parents are seen as role models. So we see that there's high expectation actually from the adolescents towards their parents and vice versa. But of course, it has implications. For example, some adolescents will say, what's the message that if I get a message from my parent asking me not to smoke, not to drink, not to, but I see that my parent is doing it, then what's the value of that kind of information? So it's a dual relationship where there's, as I said, lots of expectation coming from adolescents to their parents. Communication is the key word here. It's the most value part in the relationship with parents. They want to the kind of communication and the modalities of communication is extremely important. Because many times parents use scare tactics, saying, again, telling kids what to avoid, what not to do. But there's very little time to spend time with children, to explain things, to think together about issues. And this is what adolescents value the most, actually. So a communication where there's an equal, let's say, power within the relationship, where we both learn, we both communicate, and we both find solutions together, instead of having a parent imparting information. Okay, this is, as I said before, another important point, that of course, because of the specific age group, they value a lot freedom, privacy, and trust. And this is again related to the kind of communication and relation with their parents. And sometimes it creates, because parents want to control more than cooperate and find common solutions with their children, it leads to a lot of intergenerational tensions. Parenting styles change a lot depending of the age of the child. So we see that parents spend less time with adolescents, as I was mentioning before, particularly with older adolescents, because there is they think that they can handle themselves and there's not much support that is needed, unless a lot of them engage when it's because they fear that their children engage in taking drugs, in smoking, in drinking, or they can in early pregnancies. And so a lot of the engagement is related more to risky behaviors. Authoritarian parenting style continue to dominate in the 6 countries. But it's slowly changing. So we see that there's more opening from the parents to communicate with their child, and to have authoritative parenting style compared to authoritarian, and where there's, as I said, this imbalance in power relationship within parents and children. In 2-parent household, also patriarchal norm and traditional roles of father and mother continue to dominate. Father as the breadwinner, mother as the person responsible for raising children. But it's changing also, especially because also of economic instability and needs. Also, a lot of women have to get out of the house more and be responsible for be also breadwinners in the house. The roles and responsibility change based on the gender of the child. So there's much more expectations for girls to behave correctly than for boys. Girls are expected more to contribute to the family life, to help within the family, while for boys there's much more freedom. This is what came out of the study. And parental engagement in different aspects of life also varies. Health is the highest priority for parents, overall, basic health, but there's 2 areas where parents do not really engage a lot. One is mental health issues, the second is sexual and reproductive health, because of a lot of stigma associated with these two topics. And also maybe lack of knowledge, because parents sometimes say, well, they know more than me, I don't know even how to engage on sexual and reproductive health, because now with the internet they get so much information that they know more than me. Second area where they engage is education, but more mothers than fathers. And mainly because education is seen as an important platform for having a better job in the future. So, and then in terms of violence, we actually saw from the study that a lot of the time parents encourage violence. For example, in schools, if a child is bullied, a lot of the parents think that it's correct for the child to answer back and beat back. So this is also an important piece of information. Where do the adolescents and parents turn for support? Mostly, so what the study finds that parents feel that they are not enough supported, that sometimes the state does not have the capacities to support, or sometimes even the will to support, and they feel left alone. They also, at the same time, there's also quite a low trust in institutions and also in neighbors. So, given this situation, where do they look for support? Mainly the family, within the family, the extended family, the grandparents, and people who are more closer to the family circle, let's say. Single parents come out as one of the most vulnerable categories of parents in the countries, together with parents who migrate and the parents of children with disabilities. Teachers, well, we said, where do they ask for help from teachers? Some of them, not a lot, said that they look for teachers, and it's more those parents who are more educated. Google, internet, this is a big source of information, both for parents and for adolescents. And friends, mainly adolescents, they look for peer support. When they have a doubt, they look for help from their friends. When we looked at the mapping of what are the current modalities of parenting support in the region, we identified these 5 key forms and modalities. One is short-term awareness raising and campaigns and events, mostly in schools. So these have an advantage of reaching big number of people with short-term information related to parenting, but they depend a lot also, especially for example those who happen in schools, they depend a lot of the quality of the speaker, what kind of attitude is used when giving information to parents or to adolescents. They don't want a professor, again, they don't want an expert that is not able to communicate. So there's a human aspect that is very important. It's not just the topic itself, but how you communicate it. But and also sometimes this kind of information doesn't reach the most vulnerable parents, who are the ones who actually need it the most. There's some other medium to long-term parenting programs. We saw, for example, in Romania, the challenge is that a lot of discrimination still happens from the social workers, the educators. There's a lot of judgment towards parents, and so this leaves parents, they are discouraged from participating in parenting programs because exactly they feel judged, and they are scared that even their kids can be taken away from them. There's initiatives also related for specific parents, for example, foster parents. We saw some initiatives in this area. Peer support group is the modality that is the most liked by parents. So whether it is peer support group led by a parent or by a facilitator, it's where parents stated that they feel more comfortable in participating because it's a safe space for discussion with other parents, and they feel that they're not feeling judged. They see that other parents have the same issues, so they don't feel a failure. They don't see it's just their problem, it's a common problem, and they find common solutions. And then there's also hotline, helplines, but these are more perceived by the parents as something, an emergency situation where really something bad happens. They wouldn't call a hotline to ask for generic information. It's really related to very, cases of violence, of abuse, etc. As I said, there's several barriers. Why do parents? Don't they participate in parenting initiatives? Well, sometimes because they don't exist. So there's very limited. We saw in the mapping. We didn't evaluate any of the initiatives, but it was just an overall mapping. We see that there's not a lot specifically for parents of adolescents. Sometimes there is something, but it's not well publicized, so people don't know about it. sometimes the people feel like they don't have the competence to participate. The parents feel that they don't have the skills to understand, and they don't see the value also of participating. In terms of, and there's also a lot of indirect costs related to access. For example, distance, having to pay for transportation to reach, having no time to actually participate because of other priorities. In terms of sustainability and coordination, a lot of the programs, they are funded by the international donors, by the international community, and they tend to finish once the funding is over. So there's a lot that is not funded by the state, it's not embedded within the systems, and it tends to finish, and priorities are also sometimes established by the donor themselves. This creates issues of sustainability. There's also very little coordination between NGOs, civil society organizations, and government entities. In terms of the content, there's very little on the parenting of adolescents specifically. Most content use more scare tactics, and as I said, the approach, don't do this, don't do that. They don't build on the skills and the competencies. They don't use strengths-based approaches to build on the competencies of families and of children to make them resilient. There's no involvement of other significant caregiver. I was saying before, it mostly focuses on parents, biological parents, and there's no involvement of siblings or other caregivers that are important in the dynamics of the family. Very few involve fathers. They tend to prioritize mothers. This was mentioned also before. And then a lot of them, they're not monitored, they're not evaluated, they're not, so it's very difficult even to identify good practices, because a lot of programs happen, but there's no evaluation, and we don't know if they really worked or didn't work. So conclusion is that, of course, a positive relation between parents and adolescents is extremely important for the well-being of the child. As I mentioned before, a lot of changes have happened in the region in the last 30 years. This is changing very rapidly the way that parents and children relate to each other. There's very few parenting programs for parents of adolescents, and then many parents struggle to fulfill their obligations of care. And of course, what is coming out of the study is that the state support for parents and parenting of adolescents is not sufficient. Much more needs to be done. The parents tell us, and also the adolescents, that the parents that they feel they need new knowledge and skills on how to deal with this second decade of life. We have some quotes from one parent saying, you know, until yesterday I had a nice child, and all of a sudden they wake up, they are a monster because of the changes that happen in adolescence. So how do you deal with that? How do you teach parents how to communicate, how to understand their children, how to raise resilient children based on the specificities of how their children are, not to tell them what they need to be, but to understand who they are and raise them accordingly, raise the conscious and resilience children. And then parents, they don't skill just, as it's linked to what I was saying, not just to recognize problems, but also to better support and communicate. So a lot of the program focus on how to recognize if your child is smoking, how if there is a problem, but very few teach you actually how to communicate and involve your adolescent in decision-making processes. So in terms of recommendations, the study looks at the recommendation in 4 key areas. One is in relation to legislative framework, and you can, maybe, I also don't want to take too long in the presentation, and we will have more time to discuss this, but it's related to this recommendation that you can read is more related to really how do we specify better in the legislation the kind of support that the state provides for parents to help them raise healthy children. And then how do we move from a punitive approach to approach where you strengthen the competencies and skills of families. You can read, and I will go through that tomorrow in the last session. Then there's investing research and evaluation. As I mentioned, there's very little evidence in the region So more research is needed, particularly in some areas. One is parental migration that was mentioned before. We need to understand better how would we support parents who migrate to better communicate with their children, because we see from many parents are saying, you know, they leave the family when the child is small, then maybe they come back years later and there's a whole new configuration of the family. Even if they try to, you know, to keep the connection through internet, a lot of them speak by Skype every day, it's not the same thing. So how do we support these parents who have to migrate? Parenting of adolescents with disability or with a chronic illness, which I said is one of the most vulnerable segments of parents. Parents from minorities and marginalized group. So we need more research around that area. But also we need to identify better models and successful models in middle-income countries that can be adapted or replicated in the region. Because we saw that we have very little information on that. The third piece is related to programs, strengthening programs, meaning having more evidence-based program. As I said before, a lot of them are not documented. We need to better document and see what really works. Involve the beneficiaries, involve parents, involve adolescents in the design of parenting program to really make sure that their needs are reflected. Prioritize peer-to-peer mechanism, as I said before. You don't need many times a formal parenting program structure, but you need spaces for parents to share information, to understand that they're not alone in their journey with their adolescents. And then maybe the important piece is shift the way that parenting programs are conceptualized. As I said, try to move from risks approach, risk prevention, to actually build skills and capacities and competencies to strengthen resilience. So starting from the good aspects of that family and strengthen the resilience to raise their children. Finally, build the capacity of state and non-state actors to evaluate programs, and strengthen the capacity of service providers to deal with the most vulnerable and marginalized, to avoid, as I said before, there's still a lot of discriminatory practices from the service provider, which hinders the participation of parents. Parents do not want to be judged. They want to learn, and they don't want to be judged and labeled as bad parents. And develop, linked also to the digital age, develop more online platforms to build the capacity of parents. So these are, I went very quickly because it's 6 countries and I've tried to summarize, and then we will have more information about Belarus specifically. So thank you very much.